Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Nicole with the American Heart Association, who will be talking about the upcoming Heart Walk on Saturday, November 12th. Christine O'Brien, Vice President, Key Accounts, Sales and Account Management for United Healthcare, who will be offering helpful tips for selecting the right health benefits during this open enrollment period. And as the weather starts to get cooler today, on Eat Fit NOLA cooking segment, we'll be in the kitchen with Executive Chef Vidak Sparr of Dick and Jenny's and Emily Eikhoff of Eat Fit NOLA. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome to Community Health Heroes. Did you know that heart disease and stroke are the #1 in 5 killers of Americans? Join us today to talk about the upcoming Heart Walk in November and how it is designed to promote physical activity and heart-healthy living for the entire family is Nicole with the American Heart Association. Welcome to the show, Nicole.
Thank you so much for having me.
So can you tell me a little bit about the upcoming Heart Walk?
Sure. Our Heart Walk is on Saturday, November 12th at Champion Square. We're very excited that it's downtown this year.
Yeah.
It kicks off at 9 a.m. where we'll have some festivities, and then the walk itself is at 10 a.m. So
and where are the people going to walk at?
The walk is about a mile long, and it's going to start at Champion Square, loop around the Superdome, and then come back up to Champion Square. So we're excited about
awesome.
that.
Great location.
Yeah, we're really excited about the location this year.
So I know United Healthcare and the American Heart Association partnered up and built 4 walking paths in the New Orleans area. Can you tell me, are those being used?
Yes, absolutely. We're very excited that we have the opportunity to get people to get out and get active at those paths. Walking is a quick and easy way for people to get active and get healthy. Just 30 minutes a day is really all you need to make a difference with your heart and with heart disease.
And where are those 4 paths located?
We have one in Duncan Plaza, we have one in West End Park, we have one in Lafayette Square, and Palmer Park.
Awesome. So they're kind of all over the city?
Yes, we try to pick locations all around the city to give everyone an opportunity to utilize them.
And there's no excuse.
No excuse, exactly. They're all free. Everybody can get out there, bring the family.
So what's the purpose of the Heart Walk besides, getting the family involved in walking?
We really want it to be an event where anyone and everyone can get out there, get active, understand how doing so can help your heart health. And then also, we raise money through fundraising for research and public education programs in the city. So really a big deal for us. It's our largest event in terms of fundraising and raising awareness with getting the whole community out there.
And how can people find more information or register for this event?
Easy. Go to www.neworleansheartwalk.org.
NewOrleansHeartWalk.org.
Yes, ma'am.
Awesome. And it's next month?
Yes, next month on November 12th.
Awesome. Nicole, can you tell me a little bit more information? Is there going to be food? Is there going to be any kind of music? I know we have music all the time here.
Yeah, well, in any New Orleans event, we have to have that. So, yeah, the Heart Walk is really set up to have a lot of different activities. We are going to have a band, and they're going to play pretty much for the duration of the walk. Most people enjoy that after the walk itself. We have sponsors that will have tents out there where they're handing out items and also giving information related to heart health to anyone that comes to their booth. We're going to have what's called our Kids Heart Challenge, and that's going to be an obstacle course for kids.
Oh, neat.
Yeah, which will be great. So they'll run through tires, go around cones. So we're going to have a lot of things set up for them. We are going to have the stormtroopers from Star Wars out for the kids as well, so I know they'll be excited about that. There's free food. There is free drinks, and really, you can really stay out there as long as you like, but normally it kind of ends around noon where most people finish the walk, finish eating, and kind of take their time to get out.
Awesome. Yeah. So are there other events that the American Heart Association sponsors?
Yes, we do have a couple other events. February is Heart Month, and so we have our Go Red for Women luncheon, which really focuses on heart disease being the #1 killer of all women. I think a lot of people don't know that, and so we definitely wanted to bring that to light. And so this event is a lot of fun. There's a fashion show, a silent auction, and just people that kind of speak about their experience or survival stories that are women. And so a really good thing for women to wrap their arms around and get involved in. In the spring, we also have our North Shore Heart Walk, which is for the North Shore community to make it closer to them with the same type of things that we have at our New Orleans Walk with booths and music, activities for children as well. And then in the spring, we also have our gala, which is more of the nighttime social event with a silent auction, with music again, sit-down dinner. So a really nice formal event for people to go to raise money as well.
Well, thank you so much, Nicole, for sharing this information with us.
Thank you too. Appreciate it.
When we return, we'll be speaking with Christine O'Brien, Vice President of Key Account Sales and Account Management for United Healthcare, who will be offering helpful tips for selecting the right health benefits during this open enrollment period. So don't go away. We'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
It's time again for open enrollment. Did you know that approximately 155 million people obtain their health benefits through their employer? Joining us today to offer tips for selecting the right health benefits during this open enrollment period is Christine O'Brien, Vice President of Key Account Sales and Account Management for United Healthcare. Welcome to the show, Christine.
Thank you, Dr. Walker. I appreciate you having me.
So can you tell me what is open enrollment? I'm sure a lot of our audience just doesn't have a clue as to what that means.
Sure. Open enrollment is the time of year that companies have that give their employees an opportunity to look at their benefits and make their elections for the upcoming year.
When does it generally start?
For most companies, it is in January, or it's a January effective date, so most companies start in the October timeframe.
So sometime in the fall?
Yes, yes.
So how can our audience make better decisions, maybe save some money, and maybe improve their health?
So there's actually 5 tips that we have to improving and making sure that you get the most out of your open enrollment. The first tip is to do your homework, and that's really the most important tip. A lot of people, when they get their enrollment booklet or enrollment information, they go down to the bottom line, look for the lowest dollar amount, and pick the cheapest plan. And that might not necessarily be the best plan for them. It's important that you look above the line, that you look at what your deductible will be, what your copay will be, if your doctors are in the plan, what's covered and what's not covered. The same on the opposite, not to just go to the highest cost plan and think I need the best coverage. Look at, again, those factors and make sure that you're picking the best plan for yourself and for your family. It's important that you do your homework and you know what's covered, what's not covered, what your deductible or your copay would be before you actually need care. At the time that you're going to the doctor and need the care is the worst time to find out that you have a very high deductible and you can't afford the coverage.
Well, I know I've heard it's very confusing. Where can somebody go for a resource? I mean, or more information?
Really, the best place to go is, and that's a second tip, we have a health tools, online tools, apps that employees can use. So you can go on to the online tool for United Healthcare, it's myuhc.com, and the app is called the Health for Me app. So you can actually go online and review all of that information and check the details for that. So it's a great opportunity for you to do some homework. Also, there's always the resource of your Human Resources Department or the Customer Service Department of United Healthcare. I wanted to touch on a point of the Health for Me app. There's some really great information in that app. Easy to use. You have access to your ID card. You have access to what providers are in network and what providers are out of network. And you also have access to a really neat tool called the Healthcare Cost Estimator. And that's a great opportunity when you actually do need care and you're starting to use the services for you to go in and input what service you need, and it will pull up in your geography all the different providers and the cost for that care. So for example, if you need a knee MRI, you could put that in and see all of the different costs. Obviously, you're not going to choose your care purely based off of cost, but it's a great opportunity to find that information out and know that before you actually receive the care and find out when you get the explanation of benefits or the bill in exactly how much that was.
Great, that's great, absolutely great tip. And that's available just at the App Store, I assume?
Yes, if you're a United Healthcare member, it is available through the App Store for all smartphones, the iPhone as well as the Android phones.
Awesome. So that was your second tip about using the apps and getting information.
Yes.
So what's the third tip?
The third tip is to make sure that you take advantage of the wellness initiatives that your plan may have. So at United Healthcare, we do have several plans that have wellness initiatives built in. First is do a health risk assessment. Next is to make sure that you're lowering your cholesterol or blood pressure. Make sure that you're going to the gym. Some of our products have step-based components that the more steps you do throughout the day, the more incentive you get. So take advantage of that for two reasons. One is that it leads to a healthier you, and two, you could actually make money by using those and participating in those wellness initiatives.
So you can get healthy and save some money.
Exactly.
Awesome.
Exactly. And the fourth tip. So the fourth tip is make sure that you take advantage of health savings accounts. So if you participate in a high deductible health plan, and it's a qualified high deductible health plan, you can elect to make contributions to a health savings account. Health savings account offer a triple tax benefit. And the first advantage is that you're actually able to put money into the account on a pre-tax basis. The second advantage is that you're able to, once it gets past a certain balance amount, you're able to earn interest tax-free. And the third is that if you actually use it for qualified medical expenses, you can withdraw those monies tax-free. So it's a great opportunity for you to save money, especially if you have a high deductible health plan. Many people don't have $1,000 if they have a $1,000 deductible laying around. They can put that money into the health savings account. The health savings account come along with a credit card. So when you go to the pharmacy or go to the doctor, you can just use that credit card and pay for it out of your health savings account, which is a pre-savings amount, and you're not taking that money out of your pocket at that time.
Right, and then you're not surprised also when you have a bill, you'll have some money put away.
Exactly.
That's a great point. And what's your last tip for how do you pick your plan?
The last tip is make sure you look at all of your benefits. So there's several other benefits that can help you as well. Dental coverage, so we found that there is a link to oral care and overall health. So make sure that you look at your dental coverage and get your preventative dental care, and also your vision plans. There's certain, through eye exams, they can determine if you have diabetes or other medical conditions. Sometimes people will have an eye exam before they'll actually go into their primary care physician.
Right.
So check out vision coverage. Those coverages are normally offered at a lower rate and do offer a great benefit to you and your family.
Well, and I think a lot of people don't know that dental hygiene, like you had mentioned briefly, really goes to your overall health.
Yes.
So dental care is very important, and then you can diagnose multiple diseases by looking into your retina. So those are both really great points.
Great.
And if our audience wanted to know, where can they go if they need more help, where could they go?
Yes, so they go to their Human Resources Department.
Okay.
That's the source to find out when their open enrollment starts, how to enroll in their benefits, that sort of thing. And they can always contact United Healthcare's customer service. There's an 800 number on the back of their card, as well as myuhc.com has several pieces of information, as well as the Health for Me app.
Well, thank you so much for giving us this valuable information today.
You're welcome. I appreciate you having me, Dr. Walker.
When we return, we'll be speaking with Executive Chef Vidak Sparr of Dick and Jenny's Restaurant and Emily Eikhoff of Eat Fit NOLA when they join us in our kitchen for another exciting Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back to the show. Joining us today in the kitchen is Executive Chef Vidak Sparr of Dick and Jenny's and Emily Eikhoff of Eat Fit NOLA. Thanks so much for joining us here today.
Thank you for having us.
Yes, thank you for having us.
So what are you preparing?
So what we're going to be preparing today is a white bean, kale, and roasted vegetable soup.
Yeah.
And we have a roasted candy stripe beet salad.
Oh, that sounds wonderful. Can you tell me a little bit about the nutrition in this?
Yeah, so the soup is full of fiber, a little bit of protein. Chef Vidak here is very light on the salt, which we love at Eat Fit. And the beet salad, you know, salad dressings can creep up in the fat and the sugar and the salt, but he keeps everything really low, very little salt, very little sugar, so we love that.
And how long have you guys been partnered up with Eat Fit NOLA?
So, well, we're really excited to announce the launch of Eat Fit at Dick and Jenny's. Chef Vidak and I have been working over the past couple of months, establishing some really great Eat Fit dishes there. And I mean, honestly though, he's done everything. We haven't even had to change any of the dishes to meet our criteria. They already fit as is, which we don't see a lot with restaurants with Eat Fit. So
that's awesome.
Yeah.
So about how many items are Eat Fit approved?
At any given time, 4 to 5 on the menu.
Awesome,
And
that's
we
great.
also do a la carte daily specials, so those will fit in as well.
Awesome. And where's the restaurant located?
We are on 4501 Chapatula Street, so we're just a block above Napoleon.
Awesome, that's great. So go ahead and start preparing this dish for us.
Very good.
And we can talk as we go. The soup smells phenomenally.
Thank you, yeah. And actually, so with that, I just start with a vegetable stock that I make. Carrots, onions, celery, bay leaves, and then water. A little bit of fresh thyme goes into it. As the stock comes together, I basically then took and roasted carrots, butternut squash, onions, tomatoes, and garlic. Once they were roasted in the oven, I then returned the tomatoes, onions, and garlic and made a puree with and went back into the stock. Tends to tighten it up just a little bit. The kale goes in at that point, simmers for about 30 minutes, and then at the end, there is the white beans are added and the roasted butternut squash and carrots go back into the pot as well.
Did you have to soak the beans overnight or anything?
Yes, I also soaked the beans. I just soaked them in regular water. And again, this has a little bit of white pepper, and there is a trace amount, truly a pinch of salt for the whole thing. So it's going to yield about 6 portions out of that.
Oh my gosh, that sounds fabulous. So this is our beet salad that you're making?
Yes, this is our beet salad. So we start with shaved Brussels.
You shaved Brussels sprouts.
Yeah, we do shaved Brussels sprouts.
It kind of looks like cabbage, but that's cool.
Yeah, and then we'll take and do about a ½ ounce of feta cheese.
Okay. I didn't know you could shave Brussels sprouts. Another new way to use Brussels sprouts.
Oh yeah.
They come out very delicious.
It looks good.
And then just a small portion of spiced pecans, which spiced basically with a little bit of cayenne pepper is really the way that we do it. So again, not
we
much.
love our cayenne pepper here.
We do.
Not much additives on there other than, again, mostly raw ingredients and what's going on there. We're just going to dress it with a small amount of an orange basil vinaigrette, which is just fresh basil, a small amount of orange juice, a small amount of lemon juice, a little bit of pepper again, and extra virgin olive oil to finish it.
Yeah, and what I love about Chef Vidak's dish is he uses only fresh, local produce and wholesome ingredients, and so it was a match made in heaven, basically, for Eat Fit and Dick and Jenny's. Some really great stuff there.
And then, so basically, we'll just go to plating with the...
So these are roasted?
These are roasted candy stripe beets.
Oh, I can see they have like little, they almost look like peppermints.
Yeah, they're very pretty. They come out really well.
And it's a great fall dish.
Yes, it goes really, really well for the cooler weather. I'm just going to toss this just a little bit.
So is this recipe mostly seasonal? Is it mostly on your menu in the fall?
No, it actually, this is one that runs throughout the whole course of the year. I do tend to change some of the
that was beautiful.
The dressings on it sometimes, a little bit more towards whether it's wintertime or summertime. And the beets, I'll change those up as well. We definitely utilize golden red beets,
Depending on what's in season?
Candy stripe, correct.
Wow.
Yeah, so
all right.
It works out really well for that.
This is really, really pretty and smells delicious.
Thank you. And then this is the only little bit that it gets. So that's the only bit of the salt there.
Awesome.
We can probably go and cut this off. Looks like it's nice and warm.
It does.
Smells amazing.
So some people think soup is healthy no matter what because they just think it's low calorie. Can you tell me about that? Is that a myth?
So it's not necessarily a myth, but it depends on what's in it. So if it's a cream base, it's going to have that heavy cream, butter. That's when the calories and the fat get up there. That's something you kind of want to limit or avoid. But Chef Vidak here, he uses just like a broth base, vegetable broth, fresh vegetables that are high in fiber. A little bit of protein, but very low in salt, and
it wasn't an animal protein.
Yeah,
it's a vegetable protein.
No fat really. So it's very low calorie dish here, but it's going to keep you full, and
That is beautiful. So I understand you have a upcoming benefit coming up.
Yeah, so we would really love to invite you, Dr. Walker, and your viewers at home to our Eat Fit and Dick and Jenny's Toast the Neighborhood cocktail party. It's November 15th from 6 to 9. And Chef Vidak here will be whipping up some great Eat Fit NOLA dishes. We'll even have an Eat Fit NOLA cocktail and dessert. And we'll also be raffling off some cool prizes throughout the evening.
Awesome. Now, what was that date again?
November 15th.
That is awesome.
Yeah, we're really excited about it.
That's just great. So do you have a website or anything, or Eat Fit NOLA has a
Yeah,
website?
so you can check our eatfitnola.com website or follow us on social media. We'll be posting as the date gets closer more and more about that. So.
And I think you also have some recipes on that website too, correct?
Yeah, so we have some recipes. You can check the nutritional information of all of our Eat Fit dishes, find out more Eat Fit restaurants around you.
And plan your weekend.
Plan your weekend, basically. It makes it really easy.
I know in New Orleans that we're always talking about food and talking about festivals. Is the healthy way of eating catching on?
It definitely is. So I don't know if you're aware, but eFit started about 3 years ago with less than 10 restaurants. So 3 years later, we've grown to over 80.
Oh
We're in the Superdome, we're at the airport, just some really great, we're at Danny and Clyde's gas station. Anywhere that there's food, we can pretty much be there and show you the healthier options. And so you can indulge without the guilt and really, get some good food without feeling sick later or anything like that. If you're on a diet or
And are people coming to the restaurants and saying, do you have more healthy choices, or are they coming to Eat Fit NOLA, or how's that working?
Yeah, definitely. So, we talk with our restaurants all the time, and we want to know what works, what doesn't. We want our relationship with the restaurants to evolve, and if they're like, this isn't selling, we're like, let's come up with something else. Let's, and so it works out that way.
It's a great partnership.
It definitely is.
It works very well for us too.
And I love that so many things on your menu were already Eat Fit NOLA approved.
Yes.
Yeah, it worked out really well for us. It was a nice partnership.
So Emily, can you tell me, what does a dish have to be Eat Fit NOLA approved?
Yes, so for an entree, we limit it to under 600 calories and 800 milligrams of sodium. And we also limit it to under 5 grams of added sugar and no white carbs. So everything has to be whole grain or whole wheat to be considered Eat Fit. So it's pretty hard for restaurants, to come up with a whole wheat dish that's under 5 grams of sugar, added sugar, stuff like that. So, they take it as a challenge, so they enjoy it.
It looks like Vidak accepted the challenge.
Yes, for sure.
He did, yes.
It's certainly a good thing.
Yeah.
The healthier side of eating, especially here in New Orleans, is one that, has become a better trend for. So.
And so great that it's catching on.
It definitely is, yeah.
Well, thank you both so much for being on the show today.
Thank you for having us.
Thank you for having us.
And we'll be right back with more Community Health Heroes.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country. Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Okay.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on our health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website, www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.